Good morning, guys. Today we're going to talk about what is this importance of donor management. What is this donor management in a transplant? So that's what we're going to make a video, and we're going to discuss in detail about this donor management issues. Kindly watch the video to understand the basic details and importance of donor management in a transplant. We all know that the important raw material in hair transplant actually from the donor hair. And we are talking about today scalp donor hair. We are not talking in detail about beard and chest. Let us limit the video for only the scalp donor. We all know that this donor actually we harvest from the backside of the head, occipital region. What is the importance of donor management and what is this donor management? In the sense, when we do harvest the grafts, we need to harvest within safe donor limit. That means each patient has a safe donor limit. We cannot harvest more than that. If you do over harvestation, I'm sure your donor will get definitely destroyed, and that looks really botched at transplant, or that looks so horrible. So that is the reason each patient has some limit to harvest in one session. So when we do harvest within safe donor limit, if donor looks normal, balanced donor, and which is very normal. If not, that looks really bad. That's what the donor management. And what is the importance of this donor management is, when you just do little short haircut or whatever it is, we should not know that. No one should know that you have done a transplant, or else there should not be any seen patches around like a moth-eaten appearance kind of patches around in the backside. That's the importance of the donor management. So, why donor is going to be spoiled? What are the reasons that which lead to spoiling the donor or botched donor transplant? Is basically class 5, class 6, class 7 baldness people. They always need more hair. So most of the patient has a time constraint. When we say that first session we are going to cover 70-80%, and after 6 months minimum gap we are going to do second session, usually because of the time constraint they would say, can I get it done next day? That's the question. That's the question you get from the patient. Usually it is not going to be possible that way. If you do second day, I'm sure you're going to over harvest the grafts, and you end up in doing the backside donor damaged outcome. So whether either you're doing a 3,000, 3,500 grafts, whatever the number it is, either 1 or 2 days, you can distribute it, not a problem. But to harvest more grafts, like 5,000, 6,000, because to finish the transplantation surgery in 1 day or 2 days, even class 6, class 7 baldness, you try to over harvest the grafts, definitely you end up in kind of a donor bad outcome and donor damage. So that should not happen. So this is the one reason. Over harvesting is the one reason. Second thing is, because lack of constraint, you fall as a prey to some clinics or quacks. They don't know the donor management issues. They simply harvest more and more. They tend to damage more than what they're harvesting. Imagine they're harvesting 4,000 grafts, they would damage 4,000 native hairs in the back. So you end up a disastrous donor damage. So these are the two reasons usually happens in donor management. In this perspective, I would like to show some live examples of the patients, our patients, and few examples of other patients, how this donor is spoiled. Well, here, this patient, what we are going to show you, we did operate 2 times. That's 2 FUE harvestations has done almost more than 5,000 grafts in with a gap of almost 1 year. So the donor looks same, remains same. That means very balanced donor. So if you can observe the before transplantation and after the transplantation, 2 times of transplantation, this donor really looks almost same. If you want really, we can take one more session also. And that is the beauty of the transplantation harvestation. That's very important topic in someone has a more large bald area. They have to go with the multiple sessions rather simply harvesting more grafts and spoil your donor. Conclusion is, everyone wants more grafts, either surgeon or the patient, but I'm sure there is a limitation for the harvesting. If you don't understand the safe donor limit in each patient, we would end up in donor damage. So patients also, they should not, because of the time constraint, because they cannot come back after 6 months, they would show interest to get it done transplant next day, second session. I don't think it's possible that way. Either you are taking, imagine if there is a donor limit is only 3,500 grafts for you. It doesn't matter whether you're taking 1 day or 2 days, you get only that much hair. Plus or minus few grafts, 200-300, that's okay. But where your donor limit is only 3,000, but if you really want to harvest 5,000 in that patient, I'm sure you end up in a disastrous outcome, both results wise and donor damage wise. With this kind of transplant, you don't get any results also. So kindly talk to your expert. Accordingly, you go it, because once you harvest the grafts, the backside skin has to heal. It will take more than 4 to 6 months. Later only, it is possible to get few more grafts and reinforce the density also. So that is the conclusion of donor management. And if someone is damaged, the donor, and even if you get good hair in the front, it doesn't make any sense. That's the important point to be discussed during the transplantation procedure. Thanks for watching such videos. Keep watching for more authenticated information on hair transplant surgeries. Thank you.